By Dr. Farzana Mahdi on facilitating skill lab learning processes and experiences. The chairpersons, I request the chairpersons to please come forward. Professor Mala Kumar, she is in charge NICU Nodal Officer of Comprehensive Lactation Management Center and State Newborn Resource Center and President UP NNF with more than 40 publications. Professor Samir Mishra, sir, is here. So, ma'am, can you please introduce the speaker for us?
A very good afternoon to everyone. And it's a pleasure to introduce Professor Dr. Farzana Mahdi today for this program. And she is a former fellow GSMC Mumbai 2013. Madam is the Pro Vice Chancellor of IRA University in Lucknow. She is also the Director Academics there. And she is the Director of the Department of Personalized and Molecular Medicine in IRA University. She is the Academic Dean of the American University of Barbados also. And she is General Secretary of the Society for Allied Health and Healthcare Professionals, Education Research, Indian Society of Personalized Medicine. She's got more than 150 papers to her credit, and which have been published in various national and international journals. And she has pioneered the clinical skills lab in IRA. And it's only recently that I got to know about this wonderful skills lab that you have there from people who came from outside. Being in Lucknow, we didn't know. So it would be a pleasure to listen to you.
Good afternoon, everyone. At the beginning, I would like to express my gratitude to Professor Nityanand, Honorable Vice Chancellor, KGMU, Dr. Rameshwari, who's the organizing secretary, and the entire organizing team for giving me this platform today in this national conference. Since morning, we've been listening to various talks being delivered by stalwarts in the field of medical education. And as you all must have seen in those talks, that they are trying to talk about the CBME curriculum, which was implemented in 2019. And now the first batch is just going to go out in the field and start the practice. So we really, at this time, we need to sit back and have a, kind of a feel as to what has been achieved and what has not been, we are not able to do it as expected. And we have seen by various, the talks given by Dr. Tejinder Singh, he talked about the role of assessment, role of evaluation by Dr. Kadu, and then Dr. Nirmala Rege ma'am, who is also my teacher and mentor. She is very, very well, tried to bring so many aspects about the CBME curriculum, and in such short span of time, a person of that stature only could, fill, or give you so many points in such short span of time. I have been given this duty to talk about facilitating skill lab learning, which has become a very, very integral part of the CBME curriculum. Today, I'll be talking about the processes and the experiences which we had while we were trying to establish and run the clinical skill lab at IRA University, IRA's Lucknow Medical College. So the learning objectives, just as I told you, that understand the principle of facilitating clinical skill lab learning, and also to discuss the strategies to overcome challenges in implementation of this skill lab training. So very briefly, I would like you all of you to take through this journey, which I took as part of a FAMER Fellow 2013 GSMC Mumbai, when I took up the curriculum implementation, project. That was a implementation of clinical skills training as part of MBBS curriculum using clinical skills lab. That was 2013 when this project was approved, and we embarked on this journey for creating a skill lab and also starting the training. And not only starting the training, after 2 years of the completion of this, we also had to implement it, and it had to become, this training had to become part of the curriculum of the medical students. By that time, as you all know, there was no mention of clinical skills training through clinical skills lab. It was just taking shape. As you all see that as part of the vision to 2015 document, it had said that skill training is going to come up, and we all need to be having a skill lab specifically for the training of our medical students. So it was, the clinical skill lab was established in 2013. And then here you see the timetable where we tried to implement it into the curriculum of the first year students, because the clinical skills which we took at that time was intramuscular injection, and Department of Anatomy was given this charge to take this initiative of training the students. And then you see 2015, the second skill was also implemented, that was nasogastric tube insertion. So all this you all are hearing since morning, and all of you are aware. But as I am talking about skill, so this was the skill document which was published by NMC, and it had all the necessary information for starting the clinical skill training, establishing the lab, having talked about the competencies and the skills which are important for that particular competency. Everything was mentioned in the document, which shows the training. So as far as the skills are concerned, most of the time we talk about the skills as part of the psychomotor domain, especially the clinical skills, procedural skills. But of late, it has been recognized that the skill training cannot only be the psychomotor domain. It has to cover all the domains, be it cognitive, psychomotor, or affective domain. So for the intellectuals or the cognitive domain, as very rightly today pointed out by Dr. Tejinder Singh, that we are just training the students for clinical skills, procedural skills, and so many other things. But we are not sure whether at the end of it, can they diagnose a patient? And which depends on your clinical reasoning and decision making and these kind of skills. So we need to train our students in this domain as well, which most of us are not at the moment. But taking a cue from and realizing this today, let us all think that we need to work in this area as well. So the second part is, you can say, is communication skill, which is also very important. As you all know, that one of the roles of a IMG is a good communicator. Procedural skills, of course, we have talked about. And last but not the least is the team skills. Because at the end of it, all of us, when we are treating a patient in the ward, in the OPD, what we see that most of the times, it is not only a doctor who is going to be treating a patient. you, depending on what kind of practice you are doing or what kind of a patient you are going to see, uh, you will need a team, a complete team with you, if you want to treat that patient with good results. So team skills, including leadership skills, because at the end, you will see that when the student goes out and practices in the community or in his own private setup, hospital setup, you need to have a sense of a team, a person who is part of your team. You yourself become part of the team. But at some point, you also have to take the role of a leader. So this, I would want to skip it because it is really getting very late, and I believe that a lot of you, I mean, it's beyond lunchtime. So this is just given in the skill document, and I'm very, very sure that all of you must have gone through this mapping, this clinical skills in the curriculum. This has been shown in that skill document, and time and again, we all refer to it. So this is the skill matrix which we prepared in ERA when we started with our journey in 2015. Since then, we kept on adding more and more number of skills into the curriculum, depending on which subject or which phase the student is in. So here again, you see that these are the various skill. So one thing which I wanted to mention was here, as you see, that this clinical skill of intramuscular injection was being taught in the first semester, level 1, and it was being done on mannequins. And the assessment method which we used was for the first years was OSCE. Now, what happens when the students are joining internship? We again have this skill training program where all the basic skills are repeated for the interns before he's going to be posted into the hospital. So what happens now when they are again doing the same skill? What we need to do is that this time the assessment which we are going to do should be done by DOPS. DOPS is like where you have to observe, the student is being observed while the procedure is being done. Previously, it was being done on a mannequin because at that time the student was not having enough knowledge and he was just being introduced as to what and how intramuscular injection has to be given. But now, since now the time has come that he has to go into the hospital and maybe give this intramuscular injection. So now it has to be direct. He should be observed directly by a faculty while he's doing it on a patient, so that if any kind of there is an error, that can be corrected. And the students become more confident of going and giving this. So how did we develop our clinical skills module? What we did, depending on the skill, the department was chosen because at that time we did not have the guidelines, but now luckily we have all the guidelines. We know what skill to be taught at what level and which department needs to be doing this. So we made we made modules which were there for every particular skill. Facilitator was selected and assigned the task to develop the module. Small group teaching was done to see what all is working and what is not working. And practice session was also given. The time was given to the students to practice on the mannequin in small groups under supervision. And a mentor was also assigned for each of this small group. So here you see a flow chart where we talk about how we were trying to see that all the three domains are, we tried to cover up while we were trying to teach them the procedural or clinical skills. So first of all, we talked about that particular skill, why and when and how that skill is important and how it should be approached. So PowerPoint presentation was given to the students, followed by skill demonstration by a facilitator. Then students were given time under supervision of the facilitator. Now, the first, as you see, that covered the cognitive domain. Now, psychomotor domain, the skill was demonstrated, student was given time to practice, and each independently. And for the and then it was assessed whether the student has been able to acquire that skill or not. If not, the student goes back and practices, and then OSCE is repeated. And what we did was that in the beginning, as well as the end, you can see that the student in this checklist, you see that there was these 2-3 points which said that did the student greet the patient, did the student introduce self and explain the procedure. And at the end, what we also did was that we said you have to thank the student as well. So we tried to incorporate all the three domains. And of course, feedback is very important. Every time we took the feedback from the students as well as the faculty so that we could improve our training program. So what were the challenges which we really came across while we were going through this journey of more than 11 years now? So establishment of what we saw at that time was mainly the skill lab. If you talk about, people were just talking that it was the skill lab can only be established if you have crores of funds. So what we came up was that you can, for the undergraduate students, you can establish a skill lab with minimum resources and start your at least some of the skills by using those part mannequins and giving the training. So with minimum resources, we tried to start the skill lab. So, and clinical skill training was incorporated as part, as you have seen, of the curriculum. Regular faculty development programs to impart clinical skill training to the faculty, a structuring of modules for all the certifiable skills were prepared, documented. Clinical skill training again, I said, like any other thing, it's a teamwork and collaboration of subject matter facilitators, technicians, and the management of authorities. So we tried to do this by bringing people together as a team and working along. Of course, all this was not a very easy task. It took us 11 years to reach wherever and whatever we could have done. At the same time, if you establish a clinical skill lab, you should have a dedicated team for maintenance of the mannequins and other requirements for implementation of clinical skills modules. Like you should have technicians, biomedical technicians, if you have high fidelity mannequins. So you need to have all those things also in place if you really want to run the skill lab. So I would skip this. There was some study which we wanted to do as to how many colleges have really implemented. And it was a very basic study. And we could see that, as you all know, that very few colleges have been able to implement this. So this is just few examples where we used the clinical skill training, especially during COVID, for PPE training, how to don and doff the PPE kit. And our college, Department of Gynecology, has been given this regional resource training, has been established this center, and we are giving training to various district hospitals outside of Lucknow. This is an innovative method for which we use for anterior nasal packing on bottle gourd. Now, what happened moving further, what we did, we tried to manufacture our own mannequins at low cost, and depending on what kind of skill we wanted to teach the students. Our esteemed faculty members, they helped us to design all these mannequins. So this, as you see, this is a tracheostomy mannequin with which we did. These are this for Ryle tubes, foreign body removal, and foreign body removal from nose, venipuncture. And what we came like what we saw, that until and unless a student practices on a mannequin a number of times, it's difficult to master that skill, because you just cannot learn a skill at one go. You have to go on having, doing repeated practice, so that you can, from novice to a competent, you become, till you become competent. So what we did, we did digitalization of clinical skills training. As here you can see, we had this enhanced mannequin for tracheostomy. And this shows you that it's an example for how students can do deliberate practice using this kind of a enhanced mannequin. This mannequin was hooked up to a computer, which had inbuilt, it was every time one step the student took as part of that skill, the computer will show you on the screen whether that step which you have taken is all right or it is not. If it is not, then you go back and then practice it, and then only you can move further. And what we thought, that giving this opportunity to the students, they will be able to do the practice and will be able to learn this skill better without having too many faculty members, because as you all know that's a restraint, and we all know that we don't have too many faculty members and they have so much to look after. So moving ahead, what we did was, along with the IT people, these very same skills were converted into a game, and which had scenario-based skill training. So details are, I would not like to go into details. If anyone is interested, they can most welcome to come to our college and we can demonstrate. So moving ahead, we had interprofessional collaborative practice module for tracheostomy. In this, this was part of a Mahdi FAMER project, and Professor Anuja, who's with me, she took up this project as part of the Mahdi FAMER Fellowship and developed this module for tracheostomy, which was implemented and evaluated. And as you all know, that procedural skill like tracheostomy not only would want ENT surgeon, it should have a nurse, physiotherapist, OT technician, educationist, and trauma team technician. So this entire team is called IP, Interprofessional Education, this team, which needs to be in place if we want tracheostomy to be done. And you know what happens? Tracheostomy is done, and then later on, who's taking care? These are our technicians, nurses. So if they become part of your team, the outcomes of our patients will always be better. So this is a new approach. Actually, this is not new. Worldwide, this IP approach is being used, but in India, not much is being done. It's just the beginning of it, and we are very proud that ERA is practicing this along with nursing, physiotherapy technicians, and medical students as well. So these. So what is the way forward? The way forward is that uh, of implementation of this module, you can sensitize all the students. You can have continuous communication on digital platform. Uh, IPCP skill modules for other clinical skills are also being developed at the moment, and all the teams come together for improved patient safety. So what is the take home message? It is that, as you all must have seen, that students not only be given this training for skill, procedural skills, communication, and so many other skills, but they should also have enough time to do deliberate practice, and that too in safe learning environment, which they get in a skill lab. That has been proven worldwide. And at the same time, they should have psychological safety. Nobody is commenting, or they are not going to cause any harm to the patient. If like previously it was being done directly on patients, now they can practice and then they gain confidence, and later on, when required, when they are confident and fully trained, they can go and work with the patients. And for this, structured modules were prepared with specific, that skill which what was to be taught. Effective feedback was very important for us in this journey of 11 years throughout, not only from all the stakeholders, I can say, from the students as well as the faculty, even the technicians and the other members who were involved in this training. Now, with this so many years of working together, we are coming out with this book, having clinical and procedural skills, a step-by-step approach. It encompasses, and I'm very proud to be having my co-authors, Professor Sucheta, Professor Nirmala, Professor Anuja, and the entire team of ERA who has worked tirelessly in order to put together this book. This is the content. Here you will see all the skills, and we have tried to have the checklist and other information. So you just pick up the book, select the skill, and start with your training. So this is what we are just waiting patiently. We've been hearing for the last 6 months that book is just releasing. So let's see how much time it takes. So what is the road? So now we have always been working silently, doing our work as beavers, it is said. It's a very interesting paper by Harden et al., where they talk about 3 kind of approaches. So we have worked together for 11 years. So now we have more confident learners and who have the ability to perform clinical skills with competence. And we have phase-wise assessment every phase. So acquisition of the skills other than psychomotor, such as teamwork, communication, and of course, now we will add another dimension, that is clinical reasoning, as mentioned by Dr. Tejinder Singh. So that now with these things in place, we can have improved healthcare delivery system, and finally, a healthy society. So I come to the end of my talk, and this 15th National Conference of NCHP 2024, which is enhancing patient safety, linking HPE with healthcare, is being organized by ERA's Lucknow Medical College in the month of November. All of you are cordially invited to attend, because this is happening in your own city. So please do come and join us. We'll be very happy to host all of you. Thank you so much.
Thank you, Professor Farzana. That was really wonderful, and taking us through your awesome journey of the Skills Lab in the last more than a decade now. And I'm wondering if you're manufacturing those
Yes.
mannequins,
Yeah.
then are you also,
Now-
they
now,
available
yes,
on
now if
for
you place
sale?
yeah, if you place an order,
So if they can be on the GEM portal, it will be because ladle mannequins are so expensive.
they are very
Like
expensive.
we at pediatrics, we wonder ab kya kare, 14 lakhs for a mid fidelity mannequin, 1 crore for a.
And the biggest thing is that you cannot have these mannequin, expensive mannequins in big numbers.
Right.
And besides that, these mannequins, too many undergraduate students, if they are going to handle, it becomes, it goes out of order.
Yeah, and each
So
leg costs
each-
so much, and each
I know.
arm costs so much, and it's scary. So
Yes.
we are really looking forward to
Yes,
your.
madam, we'll get back to you
Yeah,
definitely.
yeah, GEM portal pe hona chahiye. Then we
ठीक है,
can buy them easily.
Thank you so much.
Thank you. Thanks a lot.
Request Mala ma'am to kindly felicitate our speaker with a small token of appreciation. I would also like to request Apul sir to felicitate our chairperson.